Thank you, everybody, for joining us. My name is Tammam Aloudat. I am the CEO of the New Humanitarian, and I have the pleasure today of hosting a prominent group of people who have been closely engaged in humanitarianism and its function and its critique over the past years. And we are going to talk today about, if not USAID, then what? And to clarify the idea of this conversation, obviously, the Trump administration's executive order, which came on the first day of the new Trump administration, has caused a lot of turmoil in the humanitarian and aid world, and has immediately triggered a lot of reactions from those who have warned about the dire outcomes of such freeze in USAID, to the spreading of such disruptions in aid from rich countries, and all the way to others. Those of you who have the self-hating habit of doom scrolling on Twitter will find the opposite reaction from a range of far-right to incel, audiences who have repeatedly expressed their joy about how this money is now going to be spent on Americans rather than on foreigners. Aside from all the sentiments, we felt in the New Humanitarian, having been reporting on the humanitarian crisis and the system that aims to address them, that this is a conversation that goes beyond the trigger of the freeze on aid. We have to understand the consequences of it. We have to understand the reasons for it, but we also have to locate it in a bigger picture. The humanitarian world wasn't all roses and unicorns until the 19th of January and suddenly became problematic. We have to locate that. If we don't, we risk falling into a false narrative of us thinking that only if that particular order is reversed, we're back to the sweet world we're in. To have this discussion, I have the privilege of an exceptional panel, and I will do a very brief introduction and then go from there to have some questions. We have my colleagues also will channel some of their audience questions, and I will take a second before that, given the need for all of us to work on alternative ways of fundraising, to ask all of you in our audience to consider subscribing to the New Humanitarian. You can go to New Humanitarian, thenewhumanitarian.org/subscribe membership. And we'll start. First, we have Nidhi Bouri, who is most recently the Deputy Assistant Administrator of Global Health at USAID, where she oversaw $2.5 billion in foreign assistance resources across infectious diseases, health systems, strengthening and primary health care, and global health security and emergencies. We have Deborah Doane. Deborah is the author of the book, The INGO Problem. She has worked in civil society for over 25 years as a leader and activist across human rights, development, humanitarian, and environmental and economic justice issues. We have Professor Lata Narayanaswamy. Since 2001, she has worked as a research practitioner, consultant, and lecturer on gender and development, and is the author of recently, among others, of a chapter called Race, Racialization, and Coloniality in the Humanitarian Aid Sector. We have with us Dustin Barter. Dustin is currently the acting director of Humanitarian Policy Group in the Overseas Development Institute, and as well as a senior research fellow. His work synthesizes academia, policy, and practice to achieve humanitarian system change, including intersections with peace building and development sectors. And we have also with us Stella now, who is a Kachin human rights activist and researcher from Myanmar, focusing on issues of women's rights and indigenous self-determination. Thank you all for being with us. And to start us off, I know that Stella and Dustin are sitting in Thailand at the Myanmar border now. And I was wondering, Dustin, I think Stella's still not with us yet. There might be a connectivity problem. But in the meantime, Dustin, have you seen any effects yet? Is it something that is felt on the ground? And I know that this is one context and we'll talk about others. But have you seen anything happen as a result of the aid freeze so far?
Thanks, Tammam, and thanks for hosting us all. Yeah, we've just been in discussions the past couple of days with a lot of local humanitarian actors at the border, and the impacts are already diabolical. Health clinics have closed immediately. Protection centers for women and girls who are escaping gender-based violence and other atrocities have also closed, and people have been kicked out of these centers. But what is interesting is everything that was internationally run has closed down, and local actors, as always, have stayed put and continued delivering a response and have had to advocate to these international NGOs and other actors to be able to use the facilities such as health clinics, such as GBV protection centers, and reopen them and staff them with volunteers from the existing mutual aid networks across Myanmar. So there is diabolical impacts. Everybody's worried about the food cliff. People have some reserves, but the likelihood of those reserves being extended is very low. And so you have local actors scrambling around, bringing in donations from diaspora, from local communities, doing everything they can, delivering what is a profoundly important and robust response. But there is no alternative to the level of funding that has been cut off. And the impacts are already where there are reports of multiple people who have died because they had chronic diseases and can no longer access health clinics, and there was no money to refer them to other health systems as well. So the impacts have been felt immediately. There's a big division between how international actors have responded and how local actors have responded in Myanmar.
Thank you very much, Dustin. And Myanmar is a particularly complex context. And this is one of those that are barely covered anymore. And when it was covered with the focus on the Rohingya people who have been displaced out of to Cox's Bazar in Bangladesh. However, it is worth talking about the fact that a lot of people are affected in Chan and Kachin and other parts of Myanmar by an ongoing conflict. Stella, welcome. We've introduced you hoping that you're on the way, and Dustin has just been talking about the direct effects of the aid freeze on programs in Myanmar, on clinics closing and sexual and gender-based violence facilities. Can you tell us what do you see and what would you be afraid would be a consequence of this stoppage in US aid, and whether it affects other sectors of aid that is coming to Myanmar and the ability to provide services? Thank you.
Hi, sorry, my internet is going unstable, so I'm just gonna switch to the different connection. Apology for that. It won't take long.
No worries. In the meantime, I'll just reference, as I was saying, the complexity of the crisis in Myanmar escapes a lot of the coverage, and I want to just attract attention. A freelance journalist covering the food systems and climate change, Thin Lei Win, has just published in the New Humanitarian an article on Myanmar in polycrisis as USAID freeze compounds the long-term donor neglect, and it adds a few other dimensions. I'll go back to Stella now.
Would you, Tammam, would you please repeat the question for me again? Thank you.
Yes, I was saying that Dustin has given us an immediate look at what has been happening recently, but I was hoping that you'd articulate the effects and what you anticipate or fear would be the case if that funding freeze continues.
Well, sure. Thank you for the question. So I just came back from visiting the displaced camp across the border from yesterday in the currently liberated area. And I spoke to so many teachers, healthcare workers, and mobile workers. And that uncertainty, and obviously people losing their life because of a lack of medicine, life-saving emergency medicines, and people not having, getting referrals to treat serious issues. So people have lost their life. And that is also like with not knowing why that was cut off. And they don't know the explanation. And because these people are while they're living in the fear of this airstrike, imminent airstrike, when it might come from the Burmese military regime, but also not knowing their survival, like when and where the food will come from. And so I also witnessed that children's living, learning, and studying in the bomb shelters because their school was bombed a year and a half ago. And so there is a lot of mental health crisis. And right after, they don't know that it was 90-day freeze. And things are only going to get harder. And also they cannot receive any support from the surrounding governments. And so while the situation is dire, people are hopeful that, they will find a way to continue pushing, and also that, other people who empathize the struggle for justice and will step up to support them.
Thank you. Thank you very much, Stella. This will bring us to talk about the fact that there is actually a lot of issues with understanding the aid freeze to start with. What is it? Who is it affecting? Is the waivers that keep wavering? And whether, people whether there is a common understanding about what is life-saving actually. And again, I will bring attention to an article we wrote about the effect of the aid freeze immediately on Syria, my country. And if it's just the immediate effect on food provision and water provision in Syria, where between 200,000 and 400,000 people immediately depend on this, and where the US funding is responsible for a large chunk of the aid that is being provided under the circumstances, there is going to be a massive destabilizing effect for that. There are many other examples that come and we're hearing about, and I mentioned those without having heard them firsthand, but I think it's important to talk about issues like the health effects. And here I would like to go to Nidhi. Nidhi, you've been at the forefront of dealing with global health from USAID's point of view. And we're already starting to hear firsthand accounts of people who are being turned away from HIV clinics in South Africa, for example, that are funded by PEPFAR and other US funding. Can you tell us what do you anticipate or see as effects of this freeze on particularly global health programs?
Absolutely. Thank you. So first, just to contextualize, I will say, and I departed the U.S. government just before this administration came in. It is understandable that any new administration would want to do a review of programs to ensure alignment with a policy vision. The issue that is the crux of, I think, how this has all unfolded is that the approach and sequencing of steps has completely paralyzed assistance programs because it set a domino effect that has resulted in damage, in some cases, irreversible damage. In hindsight, what would have been ideal would be to have issued a review, then identified programs that would have been exempt, have processes in place to ensure uninterrupted service delivery for those programs, and then consider a glide path or a way to phase down those that did not meet a review. That is not what happened. What happened was a review was announced and then a full freeze was put into effect. Following the announcement of a full freeze, there was a combination of announcements of a waiver, but internal to USAID, a complete breakdown of staffing infrastructure and system processes that is so core to the agency, which is a massive grant-making agency. USAID is about a $40 billion agency, about $10 billion of which goes to global health, about $10 billion which goes to humanitarian assistance. And what the read that I have had, that I think many others have had, of what is included in the waiver was that initially on the humanitarian side, it included food aid and now has expanded to not as detailed in its definition, but other life-saving activities. In health, it includes HIV, which I'll come back to in terms of what's in and out. The expanded limited waiver issued on February 6th, in theory, includes immunizations and core aspects of maternal child health programs, which would be critical to ensure continuation of polio immunization in particular, and select activities for tuberculosis, malaria, and outbreak response. What's notably was mentioned was Ebola, which is, of course, an active outbreak in Uganda, and potentially select activities for Mpox. What is not included is health systems work, which is really core to the underpinning of all health services, including in crisis contexts, neglected tropical disease work, and it's unclear what aspects of nutrition would be included, which of course can result in significant increased need. So when it comes to HIV, what is included is screening, treatment, and care for all populations, which I note because initially the all populations component was not included, and a core aspect of HIV services do reach key populations that include LGBTQI populations. Aspects of commodities movement and some aspects of laboratory support are included. But what is not included is support for orphans and vulnerable children or the administration of PrEP for all key populations. Only PrEP for pregnant and lactating women is included. And what this will mean over time is the trickle effect that we've already been seeing with the lack of a glide path or an opportunity to identify ways to fill gaps should some of these decisions have been made. People will, and they are suffering, and they are not necessarily alternatives to receive care, depending on what infrastructure looks like, the capacity of other organizations. I would particularly note concern in countries where governments have taken legislative actions to criminalize certain populations that have already made it difficult for populations, particularly some of the key populations, to access affordable and equitable medical care. And so these types of services have been a particular lifeline, and now they are under threat or completely paused. I would also note what is not included in the waiver are some of the preparedness and prevention activities that USAID is so integral in to prevent outbreaks from even happening. And so there are two issues at hand. It is the backsliding and extreme impacts of programs that are already underway or had been underway, but then also the risk of new health threats coming, which were completely preventable. And just to talk for a second, because I've heard a lot of commentary around corruption or kind of lack of guidance or adherence within USAID, which I just have to counter after the time that I spent in USAID. First of all, the notion that public servants serve anything less than their country is false. I served in the first Trump administration. I know many colleagues who were career staff that would have understood the shift in policy direction that comes with any administration and would have made sure to find the balance between meeting that policy directive and ensuring continuity of services. The notion that there is no oversight of funds in USAID USAID is false. The Global Health Bureau is actually a pretty heavily earmarked bureau. About 80% of funds are fully earmarked. And what that means is that for those officials, such as the roles that I was in at the agency, you cannot just make funding decisions without the concurrence of Congress. Those are predetermined in the way that the funds are appropriated to the agency. And while there are a lot of flexibilities on the humanitarian funding side, which I worked on for a number of years, there still is active consultation with a range of stakeholders that are relevant across the U.S. government that inform that those funds are used in a way that is needs-based, but of course adheres to policies or practices across the U.S. government. So I do have to note, essentially what we're seeing, as I said at the top, is the domino effect of the approach that had unfolded has resulted in damage that's not only already happened, but damage that in some cases is irreversible. And I think the last point I would just make is, so why, if a waiver has been issued, are we not seeing programs turn back online? What is it that's happening that's the disconnect there? So within USAID, prior to the issuing of the revised or kind of expanded waiver, the payment system in USAID was taken over by a group of individuals who were not with the agency. So career staff who typically would work on a range of programmatic areas were locked out of that system. I understand now a very limited pool of staff around the world have access to that payment system. But what that means is there's a significant backlog, and there are just not enough people internal to the agency who can actually move the money out in a way that follows all the practices that need to be done for proper oversight of the administration of funding from the U.S. government. The second is there already was and as the press has covered, waves of efforts that gutted aspects of the workforce with no apparent approach that would identify functional roles and align those with the types of activities that are envisioned to be exempted, which means that in some cases, the very staff that are core to these programs that are supposed to be exempted are not actually even employed anymore, or they had been put on administrative leave for a period of time. So you have a lot of holes in the workplace, and understandably, a lot of uncertainty of the staff that are there in what their employment duration looks like and how long. But then there also is no process internally to clarify and raise questions to clarify what the waiver can and cannot be used for. So if you have staff, whether they're in headquarters or in a USAID mission overseas, there is no apparent consolidated, systemized way where questions could be raised so that staff who want to ensure adherence to the limited waiver are able to obtain that clarification and communicate that in turn to partners. That combination parallels the impact that we already saw with implementing partners, which was once the payment stopped, once the guidance stopped, partners were put in a position of having to potentially lay off aspects of their workforce, pause on procurement orders, and so on and so forth. And as we know, it's not as if you can just flip the switch and turn it all back on. It doesn't resume so easily. So that kind of trickle-down effect has been so detrimental. But then the last thing I'd note is, on top of all of that, a gag order had been put in place at USAID instructing staff to not speak to external agencies, including within the U.S. government, let alone outside of the U.S. government, which of course raised the question of what communication could even have with staff. But it also paralleled a time where the U.S. government announced its withdrawal from the World Health Organization and a step back from other institutions. So when you look at the culmination of all of that, we have paralyzed a workforce within the U.S. government and in turn paralyzed a workforce across the globe in a way that we are going to continue to see people dying and people having increased health risks, as well as health risks that really threaten the national security of many countries.
Thank you very, very much, Nidhi. And I just want to put a couple of things in. First, you mentioned PrEP and the exception for pregnant lactating women. For those of us who aren't into global health, PrEP is the pre-exposure prophylaxis for HIV that is given for partners of people who might be exposed to HIV. And it has become, over the past years, an essential component in limiting the spread of the disease. And when you talk about the health systems, obviously, a health system that is failing or dysfunctional is a detriment to any vertical program, even if you have a waiver and resources on a vertical program. So You've answered a couple of questions that came. Paul Critchley asked, if such large reduction in numbers of USAID staff, is it realistic to assume that after 90 days freeze, there will be the capacity to manage funding? And obviously, you're saying it's not as easy to switch it on again. And also another question from Mikhail D'Souza on how accessible is it for local NGOs? And you've talked about that inability to deal with the backlog on waivers. But I want to ask another question, and here it is about, is it even feasible? NGOs have been hit hard, both international NGOs and local NGOs. They had to close programs, they had to turn away people. And in some cases, as I've heard from friends and colleagues, they had to start to fire people away, and in headquarters and in the field. And this is going to get worse. 90 months freeze is a long time. And I don't know if anyone is more optimistic than me, but I don't anticipate it for them to suddenly find everything okay and go back to business as usual. There will be a major effect on both the availability of staff across the humanitarian global health world and their ability to function. And I want here to also locate it into a bit of a bigger picture. From the information we have available publicly, the US international assistance, foreign assistance, is about 68 billion US dollars, and the information that are complete that are available publicly are from 2023. And to be clear, about a third of that, about 20 billion, is for economic development, and about 15 billion is for humanitarian assistance. USAID gives about 10 billion, as you mentioned, Nidhi. From that, of that, the State Department is part of giving, and that's about 5 billion. For those also who are interested, actually, peace and security is another 10 billion of the 68 billion. And here, the reason I mention this is that we also are not always clear about what is called assistance. That's not all going to programs of health and humanitarian aid. That goes to purchasing weapons as well. That goes to shoring security for good or bad or whatever reasons. And this is available, at least so far, and I'm not sure it will always be available, but foreignassistance.gov gives a very good idea for those who are interested in a breakdown of by country, by agency, and by amount of the US foreign aid. Thank you for telling us about the gag order, because I didn't know about that, and which is probably the purpose of a gag order. But I want to go back to the system. As I mentioned, very few of us are delusional to think that everything was perfect on the 19th of January and things went badly, on Trump's day one. And Deborah wrote a book about that called the INGO Problem. So, the premise there is that there is a problem. And you write in the book that you've been in the sector and found it difficult to cope with its situation. And you've watched it and engaged with it. And here we're talking about the humanitarian development from the margins and from the inside for the past 20 years. And you talk about a problem. Can you give us the conference pitch of that problem, and how would you characterize it now under the current circumstances, whether it's different today than it was a year ago, and how do you see that translating under the circumstances?
Sure. I mean, the situation is just amplified the problems and exposed them. And I really appreciate all the data heads that are sharing information on LinkedIn and elsewhere. Save the Children in 2024 had a contract with USAID of 1.4 billion USD. Catholic Relief Services, 2.5 billion. Now that won't be all for humanitarian services. But as one example, I did a calculation a couple of years ago. I need to update it. But 90% of Save the Children's funding for humanitarian work was government. was ODA. And so it's exposed those cracks. And USAID was just the latest line. I mean, theirs is a hard cut and the biggest donor, but foreign aid's been declining for years. Australia started 2013, 2014. They're now down to, 0. I have the figure somewhere, a very small amount of foreign aid, 0.4%, something like that. So, sorry, 0.3%, I think. There were 5 governments. We've had an overall cut just before USAID of 7.5% in the total aid budget. And increasingly, that funding is being spent in country. And I think someone asked a question about that. One of those data heads I found on LinkedIn, Ben Jordan, calculated that 98.4% of recipient organizations of the awards were based in the US. Now, some of that will trickle down, but of course, many of that is propping up the headquarters and the costs of US-based organizations rather than making it out on the ground where it's needed the most. So it exposes those cracks and makes them, felt much harder. And, it was great. Damien mentioned, some of the impacts as well as Stella on the ground and how local actors are filling in the gaps where they can, but most of those will have zero core funding. They'll be implementing partners to those INGOs or the multilateral agencies. They will be living a hand-to-mouth existence. And so the short-term impacts of this will be INGOs will be scrambling to replace those funds. They'll be shoring up their own defenses because they have commitments to staff, they have legal commitments, they'll be using their reserves, not necessarily out in programs on the ground. They'll be using them to prop up their own staff commitments and keeping those intact. So it's amplifying and magnifying the situation. We have heard from other donors. Foreign FCDO in the UK has offered apparently a portion of their funding in unrestricted to enable more flexibility. But again, a bulk of their funding, the large bulk of their funding still goes to INGOs, and they'll be British-based INGOs in the main. And just one kind of observation about beyond the numbers, I think it really shows the cracks in the systems in terms of the way INGOs work. It's almost as if there's a wall between their humanitarian work and your development work. I'm glad you mentioned peace and security. And Gaza exposed this on a great extent. The humanitarian appeal saying, look at these poor people, they're suffering, they're struggling, without naming the cause and the perpetrator and the violence, some of it coming from the same funding that they're taking humanitarian aid from. So that's part of the bigger picture. It was not a functioning system that served the needs of most people around the world, and certainly not small local actors who are really there on the ground, whether or not they have funding.
Thank you very much, Deborah. And I see Stella nodding her head, and I want to ask you, because I acknowledge we in the humanitarian conversation keep talking to ourselves, and ourselves is usually people who are based in headquarters who have access to that, and we're, even when we try, we are still having a conversation from a certain angle, and I hope we're not doing the same here. But Stella, what do you see here? What is it that this translates to you as a local activist organization and so on? How does that resonate with you?
Thank you so much. This is such an important question. And Deborah, thank you so much for pointing it out, because as what I saw at the refugee camps and also at IDP camps, inside the country of Burma and also outside the refugee camps, where people, tens of thousands, hundreds of thousands of people are just trying to survive so that they can go home as soon as they can when peace is there. But with the US aid freeze recently, so many people voluntarily just step in. Clinics were closed at the beginning because the INGOs, their donors, told them to, locked up everything, locked up the clinics, but then refugee camps committee, the local committee, members of the refugee camps, and residents of the displaced camps, they said, no, we can't close this clinic because we are part of the community. Our job is to save lives. And if that means we don't get paid, we're gonna deal with that later. Right now, we have to save lives. And so here they're taking care of each other with no pay, struggling to eat for themselves and their family members. And also one of the questions when I was speaking to people, committee members, people looking after each other in the camp, were that, why are we always implementing? Why are there so many donor organizations before we receive that 2%, 5% of the money? And then we get asked so many questions. They're investigating everything when we're taking care of our people. We have taken care of the people and communities for decades and centuries. And they're asking, when we're taking care of people, taking, each other, we're asking for all these requirements. And during all this process, they forget to help us, all these donors. And so I came back with that. And also what they're asking is people on the ground at the displaced camp, at the refugee camp, is that we do not want to depend on anyone. But at the same time, right now, we just need that little support. And also for me, we got up angry, we hearing upon the news of USAID freeze. But also at the same time, this is such a silver lining and the opportunity to reflect on that fundamental structural problems. Sure, this is, people are, as humanitarians, based in headquarters or traveling to war zone, where people lived. But then at the same time, this is not about job creation. This is about saving lives. And so we do have to remember that. And I have been told, and I have heard sitting in the meetings where people said, well, we have to protect jobs, for our INGOs. We have several hundred people working, so we have to listen to this government. I'm talking about this in the context of my own experience in Burma or Myanmar, but this is not unique to Burma. The situation is global, where people are being told, if the INGOs are told no by the military government, like in Burma, you cannot go to that area, we don't care, 10,000 people are trapped and in need of aid, then those INGO will simply listen. Is it more important to make sure that you please those authoritarian governments, or is your mission to save people? And I think it's very confusing, and often people on the ground think that, why are these UN agency and humanitarian organization working with these military dictatorship who have tortured us and traumatized us for decades and continue to do so? And so what Deborah, the points to touch upon were not just about, right, like, oh, look, the INGOs or, these problems, but I think it's not about particular INGO or UN agency. It calls for fundamental restructuring of what are we doing and why are we there for? Let's not confuse ourselves with, this employment agency. That's not what we're doing. We're there to save life. That means if saving life requires to recognize and work with people who are fighting for liberation and representing people and who receive legitimacy on the ground from their own people, and even if they're not qualified as so-called quote-unquote state actors, then it's your job as humanitarian actors and UN agency to recognize that and understand that. And once we start doing that, I assure all of us that even with this current existing amount of funding, we will be able to save way more lives than we have done in the last, several decades combined. So thank you. Thank you so much, everyone, and Deborah,
Stella,
for making
that is
point.
absolutely relevant. And I think it's hard to understand how much there is in that supply chain of humanitarianism, how many stations where money gets extracted towards salaries in headquarters, towards replication, towards excessive expenditure on multiple stations. And that is known. And that has been addressed. And that has been talked about repeatedly in reform attempts in the past, well, in my experience, at least the past 25 years. I think there is more to it, obviously. And here is where I want to go to Lata. And I quote Lata, that humanitarian actors may be understood as impartial, neutral, and outside the fray is only possible on the presumption of a white savior as the default humanitarian actor. That is, only people who would be raised as white could be seen to be acting outside the political, social, or economic subjectivities. I know many people who would have, a bit of a stroke when they read that sentence. But that translates to me in practical terms. When we talk about what Stella was talking about, there is very little accountability or assumption of corruption, assumption of badness on international NGOs. Mm-hmm. And Deborah mentions in the book about the multiple scandals that international NGOs fall into, and that's what we know, not necessarily all there is to it. And I want to tell us, how does that, what did you mean when you talked about that, and how does it translate in reality?
Yeah, so thank you, Tammam. It's a great question, and thank you to all the speakers so far. I couldn't agree more with all of you. So it's a really rich conversation. I mean, in terms of the nature of the sort of humanitarian and also the wider aid system, I think we can step back, because this question of neutrality in a way informs the wider aid system as well. And I think what's really important about this conversation is that we need to be able to hold two truths at the same time. So the first is that we have to be clear that development aid, right, is an expression of both hard and soft power, and it reproduces and reinforces colonial power relations. Right. So the way that we can explain why we're getting, for instance, these descriptions that all of you have set out about, extraction at various points in this aid supply chain, the fact that sometimes aid is actually spent on militarized spending. So we're getting these conflations at different levels, is because the hard power and then the associated control of financial resources that aid represents is partly geared towards shoring up donor geopolitical interests. And then it's likely to shape political, social, and economic outcomes in particular ways in recipient countries that serve donor political priorities. So we can see the aid system operating quite overtly in that way, even though we use this language of sort of, helping and it's neutral. But the soft power of aid, and this is no less important, and this is where a lot of the functions that we're talking about tend to sit. The soft power of aid is its capacity to make it look like donors, and particularly in the context of thinking about USAID, that this aid system, it cares, right? That we're only here to help. Right? So this is a kind of neutral presentation. This is just about this kind of support, and that it is invested in this idea of aid that is about, development or women's empowerment or global health or security, allowing us to create this illusion that we're all in this together. And in a way, those functions serve to mask those hard power realities that come with that control of the financial resources. And actually, when we think about aid, whether it's the USAID budget or it's FCDO, when we think about those budgets in the round, actually, these budgets have served as a really effective form of neo-colonial control, if you would like, that has served geopolitical interests quite favorably in the post-World War II period, and for relatively small amounts of money as compared to the wider donor government budgets. Right? So you have to spend a lot of money to look like you're doing good. But this presentation of doing good is absolutely linked to this idea of a sort of neutrality. But the point that I'm trying to make, which I think is also coming through in a lot of these discussions in the space today, but more broadly with this USAID shutdown, is that USAID is making it quite clear that they're pivoting away, that they're actually having this America first approach that is saying, in a way, we're no longer neutral. And I think that is actually leading to the kinds of agency, Stella, that you talked about. I think really so passionately, and just really amazing to sort of hear concretely about the ways in which agency is actually emerging to say, actually, we can use this as a moment of reflection and to do things differently. At the same time, I think we can also hold the truth that there are aid supply chains. As Nidhi, you pointed out, nobody would know. So many of the people that, whether it's yourself or the people you worked with, you wouldn't have joined that organization because you want to do terrible things or you're trying to make the world worse. So I think we need to also hold this truth that within this aid supply chain, and particularly with the shutdown being as rapid as it was. I mean, it was, a matter of days. We went from nothing to, 3,000 people are going to lose their job over the weekend. I mean, this was a kind of an unprecedented way to think about that. So then, whether it's the people themselves in these jobs, and in the context of the US, this was potentially meaning also the withdrawal of things like safety nets and health insurance, right? So we're talking about workers losing their jobs, which have human consequences within the US. But also within that aid supply chain, that sudden loss of livelihoods, the lack of support for resources to support service delivery at the stroke of a pen, without a care for whether safety nets exist to support both the workers that are affected and the users of those services, right? So I think for me, what's really important is that we can hold both of those truths, right? This critique of an aid system that is sort of pitching itself in this sort of neutral mode, when in fact what's being presented is really, Tammam, that quote you sort of shared from this chapter I wrote about the fact that ultimately what that is a white savior narrative. I think we can hold that truth at the same time as mourning the loss, the very real loss that is being felt, that material consequence being felt across that aid supply chain, both in relation to the workers and that sudden loss of livelihood and their safety net, alongside those people who are accessing those services, right? I think we need to hold both of those things, those as truths at the same time. And then the hope comes from the fact that realignment. So if I'm not mistaken, governments like Ghana are taking that, have announced sort of this moment where actually maybe what we need to do is to take more responsibility. So yes, we can mourn the loss of this aid, but it's an opportunity for us to collect ourselves and think of our own agency and how we solve these problems anew. So I think there is an opportunity, but it's the speed at which this has been done that I think really is as catastrophic in a way as it is the fact that we do need, as many people are saying in the comments, as all of you speakers have really eloquently said today, we do need to rethink this aid system, how it's an expression of certain types of colonial and neo-colonial power and control, but doing that in a way that takes account of the fact that, there are lives to be saved and humanitarian crisis to be dealt with. And we need to be thinking about those things, I think, at the same time.
Thank you very much, Lata. And I do want to situate this in a slightly different angle as well. The 68 billion that is being spent in assistance by the United States, including economic assistance, that is the soft power, humanitarian aid, health aid, and weapons and security systems. And you mentioned, Lata, that in the past 15 years, not only the US, but Germany, the UK, and others have started talking about stabilization, securitization, and so on as parts of their aid expenditure to justify spending on security, not only on human services. This is a fraction. The US still spends $1 trillion a year on weapons. And we agree that this is a soft power mechanism, and it's as beneficial as it is. And it's one of those questions that you have put very well And people tell you, throw the baby with the bathwater. We can't. I mean, I worked for MSF. MSF treats 15 million patients a year. If I say throw the baby with the bathwater, those aren't going to get treatment. At the same time, everything Deborah and you and Stella mentioned is an actual reality. There is a drain on the system. It has become an employment agency. People expect to live, to live off it at the cost. And you're right, Stella. I wouldn't be absolutely shocked if the drain starts at the bottom. We know that large NGOs who went into financial crises started firing field staff before they started firing headquarters staff. Despite the magnificent difference in salaries between the two, and to be much more efficient to fire bosses than to fire drivers, but that's not what happens in reality. Dustin, you share those two angles. You work in one of the most reputable research institutions on humanitarianism, and you are sitting in the field. How do we understand the system in this moment? We're losing humanitarian aid funding. I mean, a few days ago, we've heard that Switzerland is going to reduce the aid funding by about 120 million Swiss francs and spend it on weapons. And if the news are true, and I saw it on a very reputable source, but I mean, where on earth are we going when it comes to humanitarianism?
Thanks, Tammam. Yeah, and add Brussels, Belgium to that list of 25% cuts too. It is very possible to live in a post-aid, post-humanitarian world. It's simple. We need to tax effectively and redistribute that tax to provide social safety nets and social services. We clearly live with a wealth distribution problem, yet you have those in power with all the wealth imposing a very neoliberal minimal governments model across the entire world. So when all these global South countries that have become dependent on aid for various reasons, they've also had decades of impositions of cutting back the state. Their ability to tax, redistribute, meet humanitarian needs has been absolutely eviscerated for decades. So there is relatively simple solutions at the technocratic level of tax, redistribute, provide services, yet you have a very problematic alignment of Musk and this social and traditional media powers. We think Murdoch, Fox News as well, pushing this very neoliberal minimal government ideology across the world and very strong in the US particularly, then that filters down. So the impediment to actually getting towards effective governance is very, very difficult. Yet there are many countries across the world we see, from Botswana to Singapore to Norway to various different countries that recognize when we generate wealth, we can tax that wealth, we can redistribute in ways that are socially coherent, equitable, and reduce humanitarian needs along the way. So there's definitely ways to do this, but there's a lack of appetite. I think there's also a problem within a lot of the humanitarian sector that we like to put the blinkers on. Tax is a boring issue. We don't want to engage in anything beyond, what is called the so-called nexus without getting into the deeper political aspects there. So I think there are ways forward, but we need to kind of build up the alliances to be able to do this. And it involves humanitarians going beyond our typical purview of providing life-saving assistance, engaging with people there's a lot of work on the well-being economy, circular economy, different economic alliances. It's not our natural place to be connecting with these actors, but connecting with them. Also, a lot of the grassroots movements from mutual aid. We had Occupy Wall Street. The financial crisis was less than 20 years ago, and we recognized how severe a problem we have when wealth is so concentrated. Now it's even more concentrated than it was. So what we really have is a massive wealth distribution problem. And if we don't resolve that, humanitarianism is only ever going to be picking up the scraps on this overall process. So that's a few things to take forward. But also we need to go full front on with the media economic alliance, like the power of Twitter, even mentioning Twitter earlier on. We need to be shifting towards other foundations to get messages out, to connect with each other, to push counter narratives to this very toxic narrative, whether that's across various points of disaggregation of who we are, but also kind of come together to build up this kind of collective humanity that is, really struggling at the moment.
Thank you very much, Dustin. And we're coming towards the end, but I I mean, I could do this for another couple of hours, but I want to take a couple of points from what you said, Dustin, and from what you said, Lata, as well. I mean, first, I apologize. There are questions. I'm trying to channel some of those questions, but there are many of them. And I'm really thankful for the audience, for their engagement. We've had more than 750 people online with us. And that's an enormous number of you. Thank you for taking the time. I have a humanitarianism has been accused of many things, from being, too radical, to, leftist conspiracy by some, to being, the fig leaf of the system. When I hear the soft power, the immediate idea that comes to my mind is we don't seem to be in a world that cares about soft power anymore. If you look at Gaza, at Sudan, at Myanmar, at, wherever you look, it seems like hard power is enough and no one cares about appearing benevolent anymore. And that might be part of it. If we think about and here is a distinction. I've worked for 25 years as a humanitarian worker, and with many who I would trust with my life. And what we are doing is trying to separate the institutional from the individual. People have a good purpose. We end up working in institutions, but that institutional is also confusing those days. I mean, take me a few years ago, and I would say, USAID is the soft power of the US empire, and that is not where I stand. Today, I find myself standing in a place where we're losing USAID vis-a-vis a force that seems much worse and much more evil and intent on breaking the system. For humanitarianism, for aid to function, and I will ask each of you to give me a few final thoughts. For any sort of aid to function, the assumption was that we needed the multilateral system, the rules-based order, whatever you call it, and that it functioned with a certain level of reliability that allowed things to go. I don't trust it anymore. I mean, Gaza broke the last bits of faith I had in the system. I've worked in Sudan, I've worked for Myanmar, I've worked for many. If you are, and it's not only, Murdoch and his ilk. I mean, the New York Times is hardly telling us truths, or the BBC these days. I mean, the acrobatics they go to avoid talking about perpetrators or problems is just becoming comical at this point. So what would you do from where you're sitting, from where you are, if you had the ability to do something? What would you do? And I will start with Stella.
Thank you. I think this is this space like this is one of the most important places to begin with, right? And people are tuning in because they care. Like you said, despite the institution are being like, they're confusing and they're being confused themselves. But as individual, we have so much power, despite the way where the, many powerful and rich countries are leaning toward extremism and also, isolating themselves. But there are so many individual, like, we can work together and then hold, push our governments accountable and really mobilizing people, getting together and like just bring back common sense, not about making anything great again, but let's just bring back common sense and humanity. And that's the only way with, restructuring. So we care about each other. And also, like, when we talk about restructuring, I come from a place where I did not start as, my activism as a humanitarian worker. I started to build peace and I started to look at human rights because I come from a community where decades we've been, violated of our rights, war crimes and crimes against humanity and genocide in this country. And so when we look at that, let's start as aid workers and people who care, like, what does it mean to be, to look at, treat a state, who is the government? Let's look beyond that. Let's look at who are these people fighting for justice and freedom, because they just want to be treated and seen like human beings. And so I think grounding ourselves in humanity and to see beyond the state and to look at people who are providing aid, people who are caring for each other, and let's work with those people. Let's not look at so-called capitals, those this performative capitals. Let's look at where are the people who are doing the works, and let's find them, let's engage with them, let's listen to them, and let's redefine what empowerment is. Let people do the thing they need to do. Support them without imposing, our Western cultural requirements. Let's recognize them as our equal partners in the this industry and its ecosystem. Let's recognize everyone in the global South doing important work, and let's give them power to do the work they need to do, so that the resource we have, despite all the cuts, this cutting back from different governments, we can do so much more. And I believe everyone who tuned in today, because that's why they're here, they want to do the better, and they want to do the right thing. So let's think about, and let's bring back comments and care about the humanity. And so I appreciate this platform. Thank you.
Thank you very much, Stella. Much appreciated. Deborah, would you like?
I think we need to really accelerate all of the slow burn efforts around locally led development, shifting power, decolonization. I think there's some really practical things, because I don't want this all to be about big picture geopolitics, because some of us won't have that much control over that. However, we can set up new funding mechanisms for local civil society to build their own strength, rather than, if we're an INGO, building our own capacity, right? We can be shrinking the INGO and really putting in endowments, new pooled funds, other forms of investment to reduce the dependence of local civil society actors over time, so that they do work in solidarity. We can be doing things that we shift the purpose of the INGO sector to be around solidarity. And that can mean possibly stepping away and doing things differently when there is a humanitarian crisis. And many humanitarian crises are political crises. So what really is the role of the non-governmental sector in doing that? I think there's quite a lot that can be done. And where there is a bilateral relationship, and there's still opportunities to influence other donors, right? The EU is apparently rethinking its policy and starting to give a hint that, yeah, they were going to shrink their budget, but now maybe they won't be, because it's very important for them to do so. But make sure those budgets don't go back to the way they were. There is a Development Assistance Committee policy on local funding. There's lots of paperwork out there, but the actions have not met the words. And I think as civil society, we could be absolutely holding those donors that are left to account and working together in the system to do that. And that includes INGOs. And some INGOs have been very good at doing advocacy along those lines and stepping back and reducing their role. So just some practical things and actionable things that I think we can be doing to rebuild a much more fair and equitable civil society system over the medium to long term.
Thank you. Thank you very much, Deborah. And Nidhi, I'll come to you.
Thank you. No, I would echo Stella and Deborah's articulation of particularly locally led efforts. One other dimension I'd say is we need to influence how a transition of the international system is happening. There has been a lot of commentary, of course, with USAID's pull out of the global system, the trickle effect we've seen from other government donors in particular. But it's not just funding, it's also a step back from global engagement. President Trump announced intent to withdraw from WHO. Argentina and Italy both announced their intent to reconsider their membership with WHO as well. So as we have potentially this shifting that's happening, on one side, you could focus on trying to preserve things exactly as they were, or we could accept the very significant shifts in global dynamics and think of a coordinated way to influence and have a glide path so that the collateral damage is no longer people. Because the The way that this has unfolded has been dangerous, it has been destructive, and the people who've paid the price are human beings around the world who are the most vulnerable and in need of an aspect of support right now. And as we look at a system that can and perhaps should be changing, and this, of course, serving as a forcing function, as Deborah was saying, to really accelerate that thinking, the question I would pose is, what is the reframing that can look at what we have previously termed as investment assistance, actually as investment in people? And how is it that we can capitalize potentially non-traditional donors, but also civil society and government buy-in and accountability along the way to look at that shift? But this harsh way of doing it, when a system has not been ripe for change and there has not been a transition, it is resulting in a real collateral damage being people, and that cannot continue.
Thank you very much, Nidhi. Dustin, I'll come to you.
Thanks. The world needs to systematically decouple from its overdependence on the US, and that extends far beyond just USAID. You've seen Colombia and South Africa, who took principled positions against the genocide Israel committed against the Gazan population, and they've been hit by the US as a repercussion with tariffs and other threats. So collectively, the world needs to disconnect from this over-reliance. That is a fundamental aspect. Otherwise, the importance of mass mobilization, people need to come together. We need to avoid tearing each other apart and instead focus on what the problems are and who the problems are, and come together and build those alliances through mass mobilization. That's how fundamental change happens. Anything else is going to be kind of tinkering at the edges and being incremental, but now is the moment that we really need to step up and build those alliances and push for change.
Thank you very much, Dustin. Lata, thank you.
Yes, thank you. I can't agree enough with what all of you have said, and really appreciate both what you've said and how passionately you said it. I mean, just to sort of build on this point about where we go from here, for me, I guess built this idea of actually thinking about the kind of world we want to live in. The starting point for me would be that we need to accept that we are not neutral. And I think there's one thing about the global norms and the rules-based order. I think we got a little bit comfortable that these were somehow widely accepted. And then this idea that there was some neutral way to do that, I think has been entirely undermined now. And in it, again, I think there's a small silver lining, because I think this reorientation towards these expressions of hard power is forcing us to take sides. And actually, that's potentially quite a good thing. It can unleash new forms of alliance and agency, and human and planet-centered investment. So in each other. So one of the things is. And also not, again, there is babies and bathwater problem here, but I don't want to throw out the rules-based order. I want it to be applied humanely and universally, right? Part of the problem is that we're not following the rules that we've made. Most of them are actually quite good. And part of what we saw with Gaza especially is this sort of hypocrisy about to whom the rules apply, and then the language of neutrality being weaponized in favor of a settler colonial power. And then, as you say, Dustin, the US sort of coming back and using that rules-based order to apply sanctions, when actually what they've done is they've gone to the international court and they've applied the rules. So one of the things that we can do is actually, I think, to continue to demand that we follow the global rules, that we strengthen, multilateralism, the UN Tax Convention, thinking about what you said, Dustin, around redistribution, the UN Tax Convention, which is this coming together of countries to say we actually need better redistribution. That would actually be really important. Let's tackle inequality, because then when crisis occurs, which it will, those places that are having to tackle crisis will be better equipped. A humanitarian system that can actually be more reactive, but also people suffering less because we have less inequality. So I would like to see us moving towards and making demands of our governments. So in the UK, in Canada, in the US, we need to be demanding that we are, redistributing wealth, and also thinking about our colonial inheritance, thinking about that perhaps as a form of reparation. This is what we owe each other. because of these historical harms. And instead of that, what we're doing is seeing this undermining of actually perfectly good rules that if we followed them, the world would be a better place. So I think we have to sort of pick sides and then fight for a more humane and a better, more less hypocritical rules-based order.
Thank you very much, Lata. And I will say, in recognition of this, one of the most painful things in movements that have opposed what is happening is that we end up projecting anyone who is not exactly like us. I mean, we end up being much better at shooting within the trenches rather than across them, metaphorically shooting, obviously. But we have to accept that a movement for change, and that a change within a system this complicated and disconnected and this historically skewed requires a wide range of approaches and positionalities and locations and agreements and compromises among each other, and also compassion and acceptance of different views within our ranks. And I think it is time to say and then I apologize for my poor timekeeping. That has never been my best quality, but I've always thought the substance is more important than the time limitations. I want to thank very much the hundreds of people who attended with us. This is obviously not a conclusion of a conversation. A conversation that important cannot be concluded in a single session. And we will hope to have all of you continue the conversation with us. We will try to take the elements of it and put it out. This recording will be available and we will extract it as well. I want to absolutely thank the panelists who have put the time and the effort and thoughtfulness. It's such a privilege to be able to talk to you, all of you, and we look forward to talking again. And I want to thank my colleagues in the New Humanitarian who have enormously made this happen fast and efficiently and with a great thoughtfulness. Looking forward for the next times. Thank you, everybody, and have a good rest of your day.